So the primary outcome of the PROs was that when we looked at time to symptomatic progression, or the TTSP, we saw a 33% reduction in the risk of symptomatic progression or death in patients receiving amivantamab plus chemo versus chemotherapy alone. So hazard ratio there, 0.67. In the AMI plus chemo arm, we have not reached the median time to symptomatic progression. In the chemotherapy arm, it was 20.1 months. So a significant improvement in time to symptomatic progression. We also saw significant improvements in patient-reported outcomes and patient-reported key symptoms at both 6 and 12 months using the EORTC QLQ-C30 questionnaire. And then lastly, when we looked at the time to sustained deterioration in physical functioning over time, looking at the PROMIS PF8C questionnaire, we saw a hazard ratio here of 0.65. So amivantamab plus chemotherapy, a median 18.1 months versus chemotherapy alone of 11.7. So this data really builds upon the progression-free survival data, the response rate, that trend towards an improvement in overall survival. We know that amivantamab and chemotherapy, now approved in the front line, also demonstrates symptomatic progression or improvement in the time to symptomatic progression compared to chemotherapy alone.